Hi, and thank you. Every 10 minutes, someone is added to the national transplant waiting list. The truth is, the need for donors is much greater than the number of people who actually donate. Human organ transplantation is a therapeutic use of human organs as a substitute for one that is non functional. One registered organ donor can save the lives of up to 8 people. And 95% of Americans are in favor of organ donation, but only 58% are registered. I'm proposing that a mandatory organ donation registration on all state issue IDs upon applying for one. Currently, when you apply for your state ID, you may just be asked if you would like to be an organ donor on your ID. Now, this is a very personal decision, a very heroic one that can only be made by the individual. It's hard in that moment to think about what good really comes from saying yes. When you're in the registry, you are registering to be an organ, eye, and tissue donor for the purpose of saving and healing lives through transplantation. That help improve the lives of up to 50 people. If by just saying yes helps save the lives of others, who wouldn't want to wear that badge of honor on their ID? The severe shortage of organs all across all organ categories remain a major constraint facing the need for transplant. More than 155 million people have registered as organ donors, but only about 3 in 1,000 can actually become donors when they pass. Registering your decision to be an organ donor in the National Donate Life Registry ensures your donor registration travels with you, no matter where you live or move across the country. And most states allow you to choose what organs and/or tissues you want to donate. And you can update your status at any time. The field of organ donation and transplantation is one of the most regulated areas of healthcare today. Both state and federal legislation has put in place to provide the safest, most equitable system for allocation, distribution, and transplantation of donated organs. Your social or financial status play no role in organ donation. A national system matches available organs from the donor with people on the waiting list based on blood type, body size, how sick they are, donor distance, tissue type, time on the list. Race, income, gender, celebrity, or social status are never considered. 112,000 men, women, and children await life-saving organ transplants. It's important for people of every community to donate. Although donation and transplantation can take place successfully between individuals from different racial or ethnic groups, transplant success is often better when organs are matched between people of the same racial or ethnic background. People of all ages and medical history should consider themselves potential donors. Your medical condition at the time of death will determine what organs and tissues can be donated. Donors can also donate their corneas, which can give the gift of sight to recipients. Through tissue donation, a donor can enhance the lives of countless others through bone donation to repair fracture and prevent amputation, skin donations to heal burn patients, and heart valve donations to repair life-threatening defects. People tend to say no when they are unsure of what it means to donate life. They think, they're going to clean me of all my organs and I'm going to have a closed casket funeral. Well, the decision to donate will not interfere with your burial arrangements. An open casket funeral is possible for organ, eye, and tissue donors. Through the entire donation process, the body is treated with care and respect. Funeral arrangements can continue as planned following donation. Additionally, costs related to organ and tissue donation are paid by gift of life, so the donor's family incur no expense for donation. They may say, God brought me into this world with all of this, and I'm leaving with all of this. Well, all major religions support the donation as a final act of compassion and generosity. There's also the real doozy. I won't get proper care if something were to happen to me because, well, they would just want me to give my organs. But your life always comes first. healthcare teams and emergency room personnel are committed to saving lives as first priority. The healthcare professionals caring for patients are not involved in the donation process and do not have access to whether you are registered as an organ and tissue donor. Organ donation only occurs after the individual has been declared dead. Typically, organ donors are patients who have been declared dead after having suffered complete and irreversible loss of all brain function. Mechanical ventilation and medications are utilized to continue blood flow to the organs so they are able to be transplanted. In the United States, less than 1% of all deaths occur in a way that allows organ donation to be possible. There are many myths that may discourage a person from registering as an organ and tissue donor, which is why it's important to know the facts. Specially trained staff members of Gift of Life determine whether the patient is medically suitable to be a donor. If so, they will share with the family whether their loved one has already made the decision to be an organ and tissue donor. Or in the absence of a decision, the family can decide whether to move forward with the donation. Even after donation occurs, the organ procurement organization provides the donor family with support through their grieving process, including bereavement counseling and opportunities to honor their loved ones. In the absence of donor registration, families are left to make the decision about donation in what is often the worst moment of their lives, the sudden and unexpected loss of a loved one. On average, one person dies every hour in the United States waiting for an organ transplant because the demand for life-saving transplant far exceeds the available supply of organs, and one donor can save as many as 8 lives. David Fleming, President and CEO of Donate Life America. The National Donate Life Registry is available to help save lives and give hope to 112,000 people in the United States, currently waiting for life-saving organ transplants. Thousands more people are in need of tissue or corneal transplant to restore health. Join the more than 6.5 million donor registrations in the National Donate Life Registry. Help bridge the gap by checking to see if you said yes to Donate Life. Signing up on your state registry means that someday you could save lives as a donor by leaving behind your legacy in the gift of life. You may think you wouldn't even know where to start, but you can visit donatelife.net to find out more. Are you an iPhone user? Well, open up your health app. That is a white icon with a small red heart. It may ask if you'd like to allow Apple to access your information. This is your choice. Next, you'll come across a screen that says Summary at the top. Scroll down until you see the Donate Life logo. From there, you can choose Sign Up with Donate Life. The last step is just signing up your information. In the space provided, press the Done button at the bottom, and that's it. You have now done a large part in improving the quality of life for up to 50 people. That is a college lecture room size of people who get a new quality of life because of your compassion. If registering in the National Donate Life Registry through iPhone, you must be 18 years or older. After you register, you can log into your National Donate Life Registry donor record at registerme.org. Why do we see the need to have citizens opt in to help build our future? Let's put it in the hands of the legacy of our people to be a part of something great. Transplantation is one of the most remarkable success stories in the history of Medicare. Let's provide hope to thousands together. Thank you.